So I'm Denise Charlton, for those of you that don't know me. I can see lots of familiar faces in the room and others that I don't know yet. I'm really delighted to be here, and obviously my job is just to chair this morning's session, which we are all very excited about. We have a couple of rock stars with us here today from the international context, Professor Marmot and Professor Floyd, and we also have some national and local rock stars to join them in the conversation. I work for Community Foundation Ireland, and we are delighted to work with the Children's Rights Alliance and the Catherine Howard Foundation. Partnership is really important to us, and we've been delighted to partner both of those organisations as we collectively think about child poverty and what we might be able to do to contribute to some of the solutions that those of you are on the ground are advocating all the time. And it's brilliant to be joined by so many experts that are doing such wonderful work. Persistent child poverty, obviously the figures have gone up, and often that can be a little disconcerting when you're working on these issues for so long. And so many of you in the room know what that translates into. You know the difficulties then that translates into in terms of outcomes for children and young people. So that can be a little bit disconcerting. But on the other hand, there's been lots of interventions and lots of responses that are working. And the context in Ireland seems to be exciting at the moment, despite the rising levels of persistent child poverty. We do have a new government. They have committed to trying to tackle child poverty. There's a new programme for government, and it's always good to be engaging and thinking about that programme for government and how we might be able to influence it. The Children's Rights Alliance, as always, brings the membership and their partners together at very timely events, and they're going into their own new strategy and really thinking about the interventions and what we need to look at in terms of child poverty. So today is about really emphasising the importance of early years intervention. And that obviously we know, and it's proven internationally and nationally, that those interventions really make a difference, that they work, and that we really need to give the children in Ireland, where we can, the best start in life, and that if they don't get that poverty really has a devastating effect and impact on their health, on their development, on their education, critically on their self-concept and self-belonging, and that we're really on the back foot if we allow that to happen. It's really an uphill struggle to try and prevent it. And we know that the most effective measures, beyond a doubt, are investment in those early years, in really providing access to quality healthcare and to early years intervention. We know that it can really change the future of children when we do that, and really trying to break that intergenerational cycle of poverty and trauma for children and families. So with us here today are, as I said, two amazing international speakers. They're going to focus on public health and the focus on children, obviously, and then on early education and early prevention. But we're going to start this morning with the renowned Professor Michael Marmot. I think a couple of years ago, or some time ago, Leo Varadkar was given an award. And the relevance of that really is that Tanya Ward happened to be there. And as all of you know, when Tanya gets her sights on you, you don't really have much choice. And Professor Marmot, we found that it's easier just to say yes at the beginning. I know it took a little while, but as she continuously persuaded you to come and share your genius with us. We know you're working with Limerick and Cork, and we also know that you're not just here to share your insights with us, but that you're going to try and persuade our government later today to address and to really look at the Marmot principles and the impact that it's had. And you're going to share that with us now. So many of you in the room will know Professor Marmot, but just let me give you a reminder. Sir Michael has been the Professor of Epidemiology at University College London since 1985. He's the Director of UCL Institute of Health Equity. He has led research groups on health inequalities for nearly 50 years. He's the chair of the World Health Organization Commission, and he has set out an ambition, a fantastic ambition to create a global movement on social determinants of health. So, Sir Michael, we're really delighted that you can join us, and he's now going to share his expert insights and shed new light on how we can address health inequalities here in Ireland. Thank you.